This is the Fix Your Sciatica podcast.
And welcome back. I hope you all had a fantastic Thanksgiving. Today we're going to be pulling a thread that connects two parts of your body, which oftentimes gets overlooked: your feet and your sciatica. And today we're going to be diving into the kinetic chain, the idea that movement in one joint creates a chain reaction in all the others. Your back pain might literally actually start from the ground up. And so today's episode, we're going to go over the general anatomy of the foot and ankle, address how our feet affect our posture, break down walking mechanics, address two common foot and ankle issues that are often associated with sciatica pain, and finally share with you action steps on how to optimize your feet position for pain relief. So for starters, to understand how your feet affect your back and sciatica, let's start off with a quick look at the foundation. Your foot itself is amazing. There's 29 muscles associated with the human foot. 10 originate outside of the foot but cross the ankle joint to actually act on the foot. And 19 are actually intrinsic foot muscles which actually act upon the foot itself as well as the toes. When you're walking, your foot isn't just a rigid block. It's a dynamic spring designed to adapt. And knowing this, we need to understand that there can be a lot of moving parts which can in fact affect how our bodies move. The most common joints that I look at as a physical therapist include the talocrural joint, the subtalar joint, the arch of the foot, and the big toe. The talocrural joint is where the shin bone, the tibia, meets the first foot bone, aka the talus. This is where the ankle moves in motion of ankle plantar flexion or toes pointing downward and dorsiflexion or toes pointing up. And there are two crucial motions for optimal walking mechanics, which I will talk about shortly. And then we move down one joint into what is called the subtalar joint. And this is where the talus meets the calcaneus, which is our heel bone. This is where we get pronation and supination of the ankle. And pronation is when the arch of the foot flattens out, also known as pronation. And then supination, where the arch of the foot gets more intensified, and we call this inversion. Then we look at the midfoot as well. The midfoot is actually responsible for the stiffness of the foot and ankle, and if it is too loose, there's a lot of motion which can actually cause a whole bunch of issues. But that extends beyond the scope of this episode. We then move on to a little lower and the most important joint of the foot, which is going to be the big toe, which in itself is designed to move up and down. But unfortunately, with modern shoe wear and posture, and even genetics, the combination or the formation of bunions can develop, meaning that the big toe can actually point outward, and this can affect walking, which we're going to talk about shortly. So let's discuss a little bit more about how our feet can affect our standing, and I find that you can get most out of this portion of this episode by going through the motions with me or envisioning it in your foot. You're going to stand with your feet about hips width apart and turn your feet out a little bit, where the inner edges of your feet are pointing at 10 and 2 o'clock. So you're looking down, your feet are pointing out. Take note of the arches of your feet. Are they going to be up? Are they up off the floor, or are they flat against the ground? Well, what about your knees? Are they pointing straight ahead, or are they caving inward? Are they actually making contact with each other? And what about your pelvis or your hips? Are they rocking forward? Are they even? Are they rocking back? What is your low back doing? Is it super arched? Is it straight, or is it rounded? And the truth is, when your feet are turned out, this is what happens. The feet and the arches collapse inward, and this can result in what is called pes planus. You put pressure on the balls of your toes, particularly the inner edge of the toe, and this causes the big toe to actually move outward, and it can form bunions over time. You may even notice a significant callus formation on the inner part of your big toe. You're also going to notice that your knees can cave inward, and when the knees cave inward, there's rotation at the shin bone, usually outward, to make up for this loss in motion. We call it tibial external rotation. And then the inner thighs can become extremely tight. If we move up the chain, this position is also resulting in a forward rotation of your pelvis, also known as an anterior pelvic tilt. And this puts a fair amount of pressure on the top half of your quads and your hip flexors, which can make it hard to stand up straight and prevent proper hip extension or your leg going back. And then as a result, the low back has to arch or twist to accommodate for this lack of motion. And as discussed in previous episodes, the sciatic nerve is one of the longest nerves in the body, meaning that the nerve can be irritated at any point throughout its journey. But if you look at the exact opposite of what we just talked about, standing with your feet about hips width apart with your toes facing forward, and when I say toes, I mean the inner edge of your foot, If they're facing straight ahead, 12 o'clock, you'll notice that the arch of the feet are restored, the shins are oriented vertically, aka straight up and down, the knees are pointing straight ahead, they're not caving in, they're not bowing out, although in some cases if you're bow-legged, the knees may move out a bit. The thighs will then actually be pointing straight ahead, and as a result, the pelvis is often set in more of a neutral position, and this leads to the back and hips to being, in fact, even. No over-rotation, no excessive arch. The low back actually does have a natural curve, but it's neither too straight or too arched. And I like to call this position the optimal standing position. And static is a standing position, meaning that there's very little or no motion. And range of motion of the ankle and foot joints don't really matter in standing, and it's really more a matter of positioning. Although when standing, there's going to be an occasional forward and backward and side to side swaying of the body, which is a normal aspect of maintaining our posture to make sure that we do not fall. So we move on to the next step, which is walking. There are two main phases in walking, the stance phase and the swing phase. The phases themselves are broken into 4 components each, consisting a total of 8 phases. Ankle and foot mechanics will most likely affect the stance phase of gait, where weight is being placed on the whole body. So let's break it down to each component and identify what happens and its effect on the body. The first stage is what we call initial contact. This is where the foot strikes the ground, and ideally we want to be striking with our heel. What this allows our bodies to do is it allows our knees to straighten out. We need to have sufficient ankle dorsiflexion or toes pointing up to prevent us from dragging our feet and tripping over them. And at this point, ankle pronation or supination or inversion and eversion don't really have a huge role upon this initial contact. Unless you have a tendency to roll your ankles, which is often because you do not lift your foot high enough during the stage of walk, or you invert or you point your toes down and in. Once we cross initial contact, we then put weight through our leg, and this is called the loading response. And this is when the foot is flat on the ground, and the reality is not really much goes on in the stage aside from just this transition from heel strike to full foot flat on the ground. Next up is what we call the mid stance phase of gait, and at this point the idea is to have the feet point straight forward, because we know earlier in this episode that turning the feet out will result in the ankle collapsing inward, collapsing the arch of the foot, and then having the knee collapse inward, rotating our pelvis and arching our backs. So if we're moving up the chain, what ends up happening is that in some cases, if the arches of our ankles drop, or arches of our feet drop, our hip can actually shoot out to the side, and we call this hip drop. The true medical term is called Trendelenburg gait. When the hip drops to the side, it actually places a lot of pressure on the glute medius and piriformis, which are responsible for stabilizing the hip. Repetitive stress like this can actually cause buttock pain and irritation of the sciatic nerve. In some cases, if you do have weakness in your glute medius, you can often lean over the weight-bearing leg to accommodate this weakness. So what does that look like? An example, if your left leg is down and supporting your weight, and your left glute is weak, you actually lean to the left to accommodate for that glute weakness. In this scenario, there's repetitive side bending or lateral flexion towards one side. And if your pain is opposite the weight-bearing leg, you may be dealing with a herniated disc, as side bending away from the side of pain is often indicative of a possible herniation. The question is, how does this work? Now, if you repeatedly bend towards one side, the disc is going to be moving in the opposite direction. And if you do this enough, the disc can weaken and as a result can cause a bulge. On the contrary, if you're experiencing pain every time you lean over to the side of pain, you may be dealing with what is called arthritis or foraminal stenosis, meaning that every time you lean towards the side of pain, the area in which the nerve exits, aka the foramen, can actually narrow and pinch down on the nerve. Now, our spines are designed to move in all directions. However, when you bend in any direction for a prolonged period of time or repetitions, there can be bony arthritic development, which can further narrow the space of the foramen, hence making it more likely that the nerve can get pinched. Then we move on to the terminal stance. This is where we are rocking our body forward, our leg is behind us, but is still in contact with the ground. And this is where ankle dorsiflexion actually allows the shin bone to pass straight forward. It actually leans forward. And this is where also the great toe extension is needed to allow the body to shift over the toe. And when you have limited ankle dorsiflexion, this heel up position can get cut short. And that limited motion can actually result in the heel flailing inward. And this is the equivalent of the foot collapsing inward as well. As you see in collapse, the knee buckles inward, the shin turns out, the hip turns inward, and the hip cannot reach full hip extension. And so if you look at the big toe, if that doesn't have enough range of motion as well, it causes rotation over the foot the same way that the ankle limitation does. And this becomes even more prominent when you're dealing with stuff like bunions. The pre-swing is a final part of the stance phase, and this is where the foot leaves the ground. Now, with the stage right before, if the foot is not able to rotate over the ankle and toe, the foot has to turn as a way to accommodate for that lack of motion. The hip cannot extend fully using the glutes, and it results in a hyperextension of the low back. Repetitive hyperextension of the low back can cause one of two scenarios. The first is narrowing of the foramen. We talked about this area before, but with repetitive motion, bone can grow faster and faster. And as a result, the foramen can narrow, and this can further pinch the nerves that exit the spine. The other scenario is what is called a forward slippage of the lumbar vertebrae on top of the nether, which is also known as anterior listhesis or spondylolisthesis. And this forward slippage can further pinch on the nerves of your spine, which can irritate the sciatic nerve pain. In summation, the most common impact of walking is often due to limited ankle dorsiflexion and decreased great toe extension, which can lead to the ankles, feet collapsing, knees collapsing, the hips to collapse, which then places a lot of strain and overuse at the low back and the pelvis. Let's talk about the arch of the foot and how it can actually affect posture and how we move as well. Now, problems often arise when the foot's natural arch is either too high or too flat. In a high arch foot, or a foot that tends to over-supinate, the foot remains too rigid and does not unlock effectively to absorb shock. And because the foot can't absorb force, the impact is actually rapidly transferred up to the leg, which can lead to lower back and surrounding muscles having to suddenly stabilize the spine against higher forces, increasing the stress on the vertebrae and discs. So it's kind of like having to contract forcefully repetitively over time. And often with a high arch, the muscles are gripping aggressively, and with aggressive gripping of the feet, you're going to notice the muscles of the hip and back have to grip a lot as well. So we're looking at a lot of stiffness. A way to improve this motion is to massage the muscles that are truly restricted. So we're looking at the calf muscles and the muscles of the inner shin and even the arch of the foot. If we move on into looking at flat feet, or a foot that tends to overpronate, the foot stays unlocked and flexible for too long. And the arch collapses inward, turning in the knee and causing the hip to internally rotate in standing. And this internal rotation is a critical link to sciatica pain, because research has actually shown in clinical biomechanics has found that foot overpronation is associated with a higher likelihood of experiencing both acute and chronic low back pain. And so why? Because that continuous inward roll of the foot can cause the pelvis to twist slightly, with every single step constantly working the muscles and joints around your spine and potentially irritating that sciatic nerve. Another study actually looking specifically at sciatica patients found decreased subtalar pronation, and this can be interpreted as a neuromuscular compensation mechanism that the body consciously or subconsciously locks the foot down to prevent excessive movement further up the chain in response to existing pain. So it's a protective mechanism. Another way your foot mechanics are fundamentally altered when sciatica is present. Usually with flat feet, the muscles of the foot and the lower leg are too stretched out. And usually when you have flat feet, I do recommend against rolling out the arches of your feet when you're dealing with this posture. You're going to want to focus on giving your calves some love and simply turning your feet inward, so then you can focus on putting weight on the outer edge of your foot and the arch should disappear. I do have an episode all about flat feet. The link to that will be found in the show notes. So here we have all this information. What are we going to do about it, right? Here's the solution. Here are your action steps. Number one, you want to determine if your foot is flat or arched, but also pay attention to where your feet and toes are pointing as well. So just take a moment and look down. What are your feet doing? If you have high arches, you may need to focus on more soft tissue work like foam rolling and self-massage. But if you do have flat feet, you want to focus more so on foot position and even build up flexibility through your big toe. I have a video on that and I'll put it in the show notes. The third part is orthotics insoles for support, really not more so for prevention. And a lot of people have asked me about orthotic insoles. Custom orthotics are great for managing existing pain by helping you restore the normal biomechanics of your foot. However, systematic reviews of the research have shown that orthotic insoles are not yet supported for the primary prevention of low back pain in the general population. Although they are a valuable treatment aid to improve function and reduce stress when pain is already present, but they won't stop you from getting back pain in the first place, and it won't actually reduce your pain immediately. And so I like to think that insoles are more like bumper guards in a bowling alley. They help decrease the likelihood of a collapse, but it really is up to you to ensure that you are walking and standing right. And the reality is that your body is one interconnected system, and by paying attention to what's happening at your feet, you can take a massive step toward relieving the stress in your lower back, as well as reducing your pain from sciatica. And just as always, if you're looking for scientific sources, I'm going to go ahead and put them into the show notes.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.